The SmartPlug from Medennium, a flexible thermodynamic hydrophobic acrylic punctum plug designed to fit and stay in the punctum as an innovative treatment for dry eye, ultimately allowing for an increase in tear film retention while providing maximum patient comfort. This video presentation will demonstrate the proper technique of handling the SmartPlug. By following these uncomplicated steps, you will help ensure a repeatable, smooth SmartPlug insertion process. The SmartPlug comes packaged 2 plugs per box, with each plug contained in an innovative carrier. To expose and then remove the SmartPlug from the carrier, first grasp the carrier with the thumb and forefinger and squeeze the carrier base. This action will expose the top wing of the carrier. Next, grasp the top wing of the carrier with the other hand and twist back the first 3 to 6 millimeters. Once this action has been accomplished, release the carrier base and continue to peel back the top wing until it is completely separated from the carrier base. This will expose the carrier channel. Now grasp and squeeze the carrier base again. This action will expose the SmartPlug in the carrier base channel. The SmartPlug is now ready to be grasped with forceps. We recommend using the SmartPlug forceps, model 502 from Medennium. These forceps have been designed with a single groove that fits around the SmartPlug. Using these forceps, align the grooved end of the forceps with the SmartPlug. Once the alignment is ensured, gently squeeze the forceps and carefully lift the SmartPlug from the carrier. Be careful not to exert excessive forceps pressure on the SmartPlug, as this could result in damaging it. Should the groove not be aligned with the SmartPlug, or the forceps slip off the SmartPlug during the removal process, simply grasp it again with the proper alignment and proceed with the removal. Once the SmartPlug has been successfully removed from the carrier, it is ready for implantation. The SmartPlug is grasped with grooved forceps. The patient's lower lid is depressed to expose the lower punctum. Now, at least 2/3 of the SmartPlug is directly inserted into the lower punctal opening, leaving 1/3 of it external. Lubrication of the SmartPlug with saline solution or artificial tears may help to ease the insertion. At this point, the forceps can be released. Keeping the patient's lower lid depressed, the SmartPlug can be observed protruding from the punctum. The patient's body heat warms and activates the thermosensitive acrylic material, changing the SmartPlug from a rigid 9 mm cylindrical rod with a 0.4 mm diameter to a cylindrical soft gel, approximately 2 mm in length and 1 mm in diameter. The thermodynamic action of the SmartPlug, from insertion until it is completely contracted into the vertical portion of the lower canaliculus, takes approximately 30 seconds. However, variations in eyelid temperatures may affect the speed of the solid to gel transition of the SmartPlug. To speed up the final contraction of the SmartPlug through the lower punctum, the patient may be asked to blink. In this case, the SmartPlug is inserted into the patient's lower punctum, and the thermodynamic action can be observed as the SmartPlug shrinks in length and expands in diameter. When the force exerted by the expansion of the SmartPlug equals the force of resistance of the surrounding tissue of the punctum, expansion ceases, and the SmartPlug is in its final position in the lower vertical canaliculus. The SmartPlug is designed to eliminate irritation and foreign body sensation typically associated with silicone punctum plugs that have a protruding cap. It is important to note that if the ambient room temperature where the SmartPlug package is being opened is greater than 30 degrees centigrade, the SmartPlug package should then be refrigerated 30 minutes prior to being opened. This will help to facilitate removal from the carrier as well as prevent its thermodynamic activation until it is placed in the punctum. Remember these tips. Follow the precise steps in opening and removing the SmartPlug from the carrier. Release the carrier base from its squeezed position before peeling back and completely removing the top wing. Ensure alignment of the grooves in the forceps to the end of the SmartPlug. Do not exert excessive forceps pressure on the SmartPlug. And if the ambient room temperature where the SmartPlug package is being opened is greater than 30 degrees centigrade, the SmartPlug package should then be refrigerated 30 minutes prior to being opened. This concludes the SmartPlug handling technique presentation. These easy-to-follow guidelines will help ensure a successful implantation time after time. The SmartPlug Flexible Thermodynamic Hydrophobic Acrylic Punctum Plug from Medennium, providing ophthalmic patients with a new way of seeing.